Hi, my name is Atif Darush, professor and consultant of obstetrics and gynecology. Many patients come to the clinics asking about the role of supplements in fertility. And you know that infertility couple are searching in the internet and in all publications on some supplements that may improve their fertility. One of these important supplements that are asked by the patients is omega-3. Is it essential for fertility or not? This is the main topic of this lecture. We have to know that omega-3 is a fatty acid, okay? And fats and fatty acids are classified into two major classes. The first is saturated fatty acid, which means saturated by hydrogen. As you can see here in this this figure, that hydrogen ions are saturating the carbon in the construction of this fat. So these are saturated by hydrogen, but they have only one bond between two carbons. So it is a mono bond between the two carbon ions and saturated by hydrogen. This saturated fatty acid is solid at room temperature. Actually, it is not healthy, and the American Heart Association recommends only up to 6% of diet of saturated fatty acid because it carries risk of increasing low density lipoprotein, increased insulin resistance, and decreased testosterone in male, and decreased ovarian reserve, and ovarian increases ovarian aging in females. So the saturated fatty acids are not recommended. Okay. Now we go to unsaturated fatty acids, which means unsaturated with hydrogen. And these unsaturated are characterized by containing double bond between two carbon atoms. Two carbon atoms, they have double bond, okay? The unsaturated may be mono, which means one double bond. This is called monosaturated fatty acid, like this picture. And this sort of fatty acid is liquid at room temperature, unlike the saturated, okay? Some unsaturated fatty acids have more than one double bond, and this is called polysaturated fatty acids. The monosaturated example is omega-9 fatty acid. The examples of polyunsaturated with more than one double bond between the carbon atoms is omega-3 and omega-6 fatty acids. Omega-6 and 9 are coming from plant-based diet, but omega-3 may be from plant and maybe from animal. We have to mention also that there is what's called trans fatty acids, which means fatty acids unsaturated became hydrogenized with adding hydrogen atom to bond opposite sides of the chain of carbon-carbon double bonds. So it is hydrogenated oil, changed into solid form, became like saturated. So the trans fats and saturated fats are not good for health. Generally speaking, the unsaturated are healthy and helpful to the human individual. The saturated and trans fats are solid at room temperature. The others are liquid. Why it is called omega? We have to know that omega-3 and omega-4, omega-6, omega-9, and so on. So this is the position of the final double bond in the unsaturated fatty acids in relation to the tail, which is the omega of the end of the chain. So omega-3, this is the site of the double bond in this chain of the molecular chain. So we have omega-3, omega-6, which are polyunsaturated fatty acids, and they are important structural components of cell membranes and serve as precursors to bioactive lipid mediators and provide a source of energy. And the action of omega-3 is anti-omega-6, which means that the omega-3 is anti-inflammatory and omega-6 is pro-inflammatory. So it stimulates the release of some prostaglandins that promotes inflammation, and this is good to for the processes of the body, and the pro-inflammatory function of the omega-6 is a key role in immune system. When the omega-6 increases, there is increased risk of inflammation and inflammatory disease. So the omega-3 has super useful role, while omega-6 is useful, pretty useful, but should not be used or should not be produced, should not be eaten more than the normal levels. Omega-9 is not very useful, and it may help to decrease some cardiovascular diseases. If we look to omega-3, we have to consider three important types. Because omega-3 is not usually cannot be made by the body itself, it may be DHA, which is a 22 carbon fatty acids, making up to 8% of the brain weight. Some studies found more than this figure, and so it's important for the brain development and function, DHA. And we have EPA, which is an anti-inflammatory with 20 carbon fatty acid, and ALA with 18 carbon fatty acids. As I already mentioned too, the action of omega-6 is against or anti-omega-3. So omega-3 is anti-inflammatory, this is pro-inflammatory. This relaxes blood vessels, relaxes airways, improves circulation, relaxes muscle spasms, reduces blood clotting, and decreases pain sensitivity. While omega-6 is responsible for prolongation of inflammation, constriction of airways, constriction of blood vessels, increased blood clotting, reduces circulation, increases swelling, and increases pain sensitivity. The omega-6 provides energy and support inflammatory response of the immune system, while omega-3, as I told you, DHA is important for brain, EPA anti-inflammatory, and the ALA is a short chain type of the polyunsaturated, and it is a source of DHA, but up to 9%, source of EPA up to 20%. So the body should have extra DHA and EPA because the endogenous transformation of ALA to either of these types of polyunsaturated fatty acids, which are long chain, is low. So we have to take diet containing DHA and EPA. ALA is a plant origin, but the most important is DHA and EPA. And they are supportive of low-grade inflammation as well. So the classes of essential fatty acids, either polyunsaturated or monounsaturated. Now this is polyunsaturated, omega-3 and omega-6. And omega-3 may have long chain, which are DHA and EPA, 22 and 20 carbon chain derivatives, or short chain, which is LA18. This is short and these are long. And these come from EPA and DHA usually come from oily fish, krill oil or algae oil, and the omega-6 linoleic acids and arachidonic acid. And they come from vegetable oil and some oils, and the arachidonic acid come from meat, eggs, and protein. So DHA and EPA sources, either animal source, which is marine omega-3 intake, or plant source, algae omega-3 intake. And this is the plant source of omega-3. For vegetarians who do not eat animal fish, or for vegans who are strict vegetarians, they do not use or eat animal products like milk and eggs. So the marine source is the main source or animal source of DHA and EPA. Uh, uh, the normal individual to have sufficient level of omega-3 in his blood should eat at least two parts or two pieces of oily fish per week, and this can ensure getting enough omega-3. The example of marine omega-3 intake are low mercury containing oil fish like salmon, fresh tuna, shrimps, sardines, mackerel, and cod liver oil also is a source, but cod liver oil is not a pure omega-3, contains also vitamin D and A as well. In this topic of omega, you have to put in mind that there is what's called omega healthy balance. What is this balance? The normal individual should have balance between omega-3 and omega-6. I told you omega-3 is anti-inflammatory, omega-6 is pro-inflammatory. So ideally, omega-3 to omega-6 ratio is 1 to 1. And this comes in the Mediterranean diet. I told you in a previous lecture on installs the advantages of Mediterranean diet for the health. And this is another advantage of Mediterranean diet with high fiber whole natural foods. While Western diet is not good, it's full of saturated and trans fats, and these are not healthy at all. And the omega-6 level in the Western diet may reach 17 times more than omega-3. I told you the normal balance is that 1 to 1. So if omega-3 increases, this is good because it is anti-inflammatory. And if omega-6 increases, not good because it is pro-inflammatory. So we have to decrease omega-6 by consuming fewer processed food and vegetable oils. As I told you, increased omega-6, omega-3 ratio leads to some problems, including GIT problems like inflammation of the intestine and so on. We have to know that fatty acids are esterified to phospholipids as a part of cell membrane. So fatty acids are important for the whole body cells because it is esterified to phospholipids that forms the cell membrane of any cell of the body. This is the principal function of fatty acids. We have to know also, in addition to omega-3, omega-6 healthy balance, that the omega-3 and omega-6 are competitors, which means that they are competing for the same site in the cell membrane, as if there is a 3-lane way, and these cars are coming to a 1-lane end. So there is a competition for this one point within the cell membrane, and omega-3, if it is low, if compared to omega-6, it will not reach the site of the cell membrane. So there is a competition on this site of action. And this picture should be put in mind to know that the balance is essential as both omega-6 and 3 are structures of cell membrane, as I told you, and serve as precursor to bioactive lipid mediators and provide a source of energy. Okay, this was a basic information about the omega, different types of omega and different types of fats or fatty acids. What about females? As I told you, it forms the estrophyte to form the cell membrane. So it is important for the cell membrane of the oocyte and other parts of the body. Omega-3 is anti-inflammatory against omega-6, which is pro-inflammatory. So it is anti-inflammatory, decreases inflammation in the ovaries, uterus, and other reproductive organs. Omega-3 is responsible for decreasing pro-inflammatory cytokines, which are related to omega-6, and this contributes to ovarian stress, contributes to oxidative stress, which is attributed to increased omega-6 omega-3 ratio, especially in obese patients with a lot of adipose tissue. So omega-3 in females is an anti-inflammatory, decreases pro-inflammatory cytokines, increases blood flow to deliver the nutrients and oxygen to the ovary and improving oocyte production quality, alters prostaglandin biosynthetic pathways to increase folliculogenesis, oocyte maturation, embryo quality, and implantation. Omega-3 in females improves hormonal balance. Why? Because it is a source of cholesterol, which is a precursor of all steroid hormones. Moreover, it has direct and indirect effect on steroid biosynthesis through regulation of enzymes and prostaglandins. We have to know that polyunsaturated fatty acids metabolites affect embryo implants. So omega-6, PUFA, which is pro-inflammatory, increases some sort of prostaglandins that makes vasoconstriction like prostaglandin E2, while omega-3 PUFAs are anti-inflammatory, 3 series prostaglandin like prostaglandin E3 and prostaglandin F3 alpha and prostacyclin increase, which make vasodilatation. So the balance between omega-3 and omega-6 is essential all the time. If omega-6 increases, this is increasing a special type of prostaglandin, which leads to vascular problem of the placenta and impaired implantation. So increased vascular permeability, angiogenesis at the implantation site, decidualization, extracellular matrix remodeling, embryo transport, blastocyst growth and development, and trophoblast invasion. All these are mastered by the omega healthy balance between omega-3 and omega-6. So omega-6 is important as a pro-inflammatory, and omega-3 is important as an anti-inflammatory. And there is a balance. If one of them increases, this is not good, particularly if omega-6 increases. If we go in depth inside the ovary and to see the oocyte, I told you that these fatty acids, omega, are esterified into phospholipids, which forms the cell wall of the oocyte. So this is the first function. The oocyte membrane composition is a key factor for fertilization, since a successful conception requires a series of processes starting with recognition and fusion of the sperm and oocyte membrane. So if the membrane is not good, not formed by omega, so the fertilization process is affected. This is the first function of omega or fatty acids in the oocyte. The second function, that the fatty acids are stored as neutral lipid droplets, like lipid droplets inside the cytoplasm, which are liberated into the cytoplasm as free fatty acids, are taken by the mitochondria for the process of ATP production. So the BUFA or polyunsaturated fatty acids, omega, are essential for cell membrane, for fertilization of the oocyte, and for fat, for ATP production inside the mitochondria. Don't forget this picture. I always put it in the lectures of basic sciences. Here is the cumulus cells. Here is the oocyte, and this is the follicular fluid. So the fatty acids, the production of ATP is dependent on mitochondrial control by the fatty acids, by glucose, pyruvate, and coenzyme Q10, and others. So it's proposed that healthy mammalian oocyte mitochondria requires a balance of pyruvate and fatty acid oxidation to maintain a lower level of otherwise damaging ROS production. This balance is disrupted in conditions of excessive or insufficient substrate. So the conclusion of this figure that fatty acids are important coming into the follicular fluid come to go inside the oocyte via gap junctions or directly into the cytoplasm of the oocyte, and forming, some of them are forming lipid droplets as a store, and some come to the mitochondria to complete the process of ATP production. So fatty acid is important for the cell membrane, as I told you, and for energy production. So if the maternal increased fat diet or obesity, uh, obese patients may have negative intracellular effects, such as endoplasmic reticulum stress response, oxidative mitochondrial damage, DNA damage. In obese patients, this process is disturbed, particularly mitochondrial dysfunction and DNA damage, in addition to endoplasmic reticular stress response. So this is the follicular fluid containing fatty acids. Also, fatty acids in cumulus cells come through the gap junction, and this comes from the cell membrane. So there is fatty acids, BUFA, inside the systole of the oocyte, and some is stored as lipid droplet, and some come to the mitochondria in collaboration with pyruvate and coenzyme Q10 to produce ATP. And the lipid droplets is a storage site of the fatty acids as neutral triglycerides. What about aging of the oocytes? It has been found that giving the patient omega or eating diets containing marine omega or plant omega, algae, can improve the oocyte quality and decrease aging process of the ovary by increasing the amount of fatty acid entering into a lipid droplet and enhancing ATP production and mitochondrial function. So with aging, there is decreased ATP production with within the oocyte, decreasing energy production capacity and mitochondrial function. This may have an impact on oocyte quality and are important mechanism for aging, as I told you in the lecture of coenzyme Q10. What is the summary of this? The summary that omega-3 is important for female fertility. It enhances steroidogenesis as a source of cholesterol, which is the main precursor of all steroids, cellular energy provision. It's important for cell membrane, for mitochondrial functions, and ATP production. So the oocyte quality, embryo implantation, embryo quality, sperm health, anti-inflammatory functions are advantages of omega-3 in the females. It has been found that by improving hormonal balance, uterine function, there is prostaglandin synthesis and steroidogenesis modulated by omega-3 if the level or the balance is good. By this way, women on diets containing a high level of omega-3 have higher circulatory level of estradiol and improving embryo quality. In addition, in cases of polycystic ovarian disease, the patients using omega-3 supplements for at least 8 weeks would have decreased LH, LH-FSH ratio and decreased adiponectin. If we go back to the pathogenesis of polycystic ovarian disease, you will see that the main problem of PCO is insulin resistance and hyperinsulinemia. And this can be caused by different causes, including inflammation. Here comes the role of omega. Omega as anti-inflammatory, not omega-3 as anti-inflammatory. Omega-6 is pro-inflammatory. So if we give the patient omega-3 as anti-inflammatory, this will prevent inflammation that leads to insulin resistance, hyperinsulinemia, which goes to the 3 target organs of the fat, which are adipose tissue, skeletal muscle, and liver, and subsequently would lead to decreased 6-hormone binding globulin and decreased glycogen synthesis, insulin signaling decrease, and the ultimate result would be androgen overproduction, increase LH-FSH ratio, increase antimolecular hormone, and other sequelae of polycystic ovarian disease. As I told you in the lecture of a new concept of PCO, we don't have to look to the ovary as a disease. Ovary is a result of the pathogenesis which occurs in the body. In conclusion of this slide, omega-3 is an anti-inflammatory, prevents inflammation that provokes or stimulates insulin resistance, increases insulin resistance and hyperinsulinemia. And this is the lecture. You can go through it in this channel. So in PCOS, there is increased androgen, increased insulin, increased LH, increased antimolecular hormone, and angiogenic factor imbalance, like vascular endothelial growth factor and others. This will lead to anovulation, ovarian hyperstimulation, stromal hypervascularity, and low fertility. So omega-3 improves insulin resistance. As I told you, it is anti-inflammatory. And this can be explained by 3 mechanisms like mitochondrial dysfunction, endoplasmic reticular stress, and oxidative stress. So the recent publications found that giving omega-3 fish oil, PUVA, would activate mitochondrial fusion and mitochondrial function in addition to ATP production, as I already mentioned. The anti-inflammatory effect of omega-3 is essential, particularly if you find an obese patient. They found that they have increased macrophages and neutrophils, which may damage the effect of the insulin and insulin receptors in the cells. So omega-3 healthy balance is essential. Don't increase the dose or the amount of omega-6 in the diet. As already mentioned, that omega-3 is important for polycystic ovarian disease, inhibits insulin resistance by being an anti-inflammatory. It is immune modulator, insulin sensitivity, and cellular differentiation and ovulation stimulation also are effects of the omega-3 in polycystic ovary, in addition to a beneficial effect on some cardiometabolic risk factors in PCOS by decreasing prostaglandins that lead to vasoconstriction like COX-2 and increasing activity of antioxidant enzymes. In a systematic review of 21 articles, they found that omega-3 in PCOS decreases insulin resistance, lipid profile modulation, decreases total cholesterol, triglycerides, increased high density, which is predictive, and regulation of androgen profile. In addition to antioxidant profile and inflammatory biomarkers, like decreased C-reactive protein, are seen after 12 weeks of use. What is the duration of giving the patient supplements of omega-3? It's variable. If you are searching for improving lipid and the glycemic profile, you can give it up to 12 weeks. But if the patient has androgenic profile with PCOS, it needs prolonged period up to 6 months. And if the anti-inflammatory and biomarker inflammatory process uh, target of the treatment, it's more than 12 weeks also is needed. And the dose is variable in studies, maybe 1,200 to 1,500, and other studies found less amount, less dose. And you know there is controversy between the publications regarding the doses. What about IVF patients? Can we give them omega-3? Yes, we can give, because it may lead to improvement of the quality of the oocyte, improvement of clinical and IVF, embryologic IVF outcome, clinical pregnancy rate increases, decreases ovarian aging or delays ovarian aging, improves egg quality, improves pregnancy rate, and supports healthy fetal and infant development. There are some studies to support the role of omega in IVF published in a recent review article or systematic review. And this an example of study of positive association of consumption of long-chain omega-3, which are DHA and EPA, that they improve the quality of the oocyte of the IVF if it is given prior to IVF. As I told you, it may be taken up to from 8 to 12 weeks. This is another systematic meta-analysis which shows that omega-3 intake significantly improves women's pregnancy and fertilization rate. However, the high heterogeneity in the review somewhat limits the interpretation. These are the facts relating female. What about male? PUFA, which are polyunsaturated fatty acid supplements, ameliorate or mitigate sperm quality, improves sperm quality by increasing energy metabolism, ATP, from the mitochondria, decreasing oxidative stress. So these are essential for the quality and motility of the sperm. On the other hand, saturated fatty acid increases cholesterol, decreases testosterone, and by this way, decreasing energy production. So this is the first function of the omega-3 in male by improving mitochondrial function, ATP and mitochondrial fusion and other functions of the mitochondria. This is number one. Other studies found that the patients eating Western diet with high omega-6, omega-3 ratio, and increased saturated fatty acids and trans fats, this will lead to more insulin resistance, more leptin, oxidative stress, decreased testosterone, and so there is decreased sperm motility, number, and quality and morphology. So omega-3 is not only improving the motility, it also improves concentration, motility, and morphology as well. Don't forget that omega-3 is a fatty acid which forms the cell membrane of the sperm. So if it is in a good amount, it enhances the process of penetration of the oocyte. So omega-3 is important for cell membrane of the oocyte and the sperm as well. Don't forget it is stratified to phospholipids as a part of cell membrane. And this is essential. So it improves sperm quality, motility, number, vitality, anti-inflammatory, antioxidant, increasing blood flow to the testes, improving sperm production, and improved hormonal balance by increasing testosterone. Some studies found that supplementation of infertile women with omega-3 results in a significant improvement in sperm motility and concentration of DHA in the seminal fluid, and this is observation or a result of a systematic review. But again, there are differences in the studies regarding doses and duration of use. So in conclusion of this lecture, I would say that Mediterranean diet is an ideal diet as a source of omega-3. Consider omega healthy balance between omega-3 and omega-6. Omega-3 has a definite role in both female fertility and male fertility. Its role in PCOS is appreciated by decreasing insulin resistance and other functions in the mitochondria, reticuloendoplasmic reticulum, and DNA. Also in male, it improves semen quality. Thank you.